Hello, I'm Dr. Mark Blum.
Hello, I'm Dr. John Cosmi.
I'm Dr. David Freilich.
Hi, my name is Dr. Leonid Mandel. Welcome to Cardiology Associates CCPHP.
I believe Castle Connolly Private Health Partners is going to bring a great deal to the table to help us enhance our relationships with the patients. They've really been a pioneer in the development of concierge medicine.
Concierge medicine will enable us to spend more quality time with patients, answer questions that are of concern to patients, and educate patients.
It holds the promise to provide more thoughtful, more comprehensive care.
And not only we will be doing that, but in addition, our staff and extenders, such as nutritionists, such as health coaches, such as exercise physiologists, will work with our patients to tailor a very specific plan.
It'll really be a true team approach, which is something that most patients do not encounter when they have a visit with an individual doctor.
We're going to be setting aside time so that if patients want to be seen on a given day, whether it's an emergency or not, they will have enough time to get those answers that day. They can call us or they can come in and see us the same day. And I think that's going to enhance the experience for the patients.
Patients need help from a variety of providers and from a variety of different services. And by us having those services in this program, which we have not been able to provide before, we think we'll be able to give a patient the access to improving his or her health tremendously.
When you take a comprehensive approach, when you have the time to have a relationship with the patient, when you by that you empower patients to participate in their health, and that always gets you better outcomes.
So the concept of wellness is very interesting because a lot of doctors would describe that in medical terms. They might say your blood pressure is fine, your lungs sound clear, so I think you're well. Patients often have a very different perception of wellness.
Wellness is looking at a patient as a whole person, looking at the patient's personal needs, looking at the patient's physical needs, looking at the patient's psychological needs.
People are going to feel better about themselves and feel better physically. So I think it's going to be a great thing.
I thought medicine was challenging. Medicine was all-encompassing. It was an opportunity to create or give the greatest good to the greatest number of people.
We never feel good leaving a patient with unanswered questions. We never feel good about walking out of a room to a patient saying goodbye and knowing we have to move on when they're still sitting there.
I think like a lot of people who go into medicine, my real first motivation was to help people get better.
I fight to prevent patients from feeling like numbers, and that throughput is important.